what we are going to do with these equipment is not just to have them at the Georgetown Hospital, but we are also going to decentralize some of these equipment. Our intention is to have some capacity at the regional hospitals as well as the Georgetown Public Hospital. In addition to that, over the last 2 or 3 days, we have been working to get the ICU at the Ocean View facility up and running. So some of this equipment would also go to the Ocean View facility. We are extremely pleased that today we are receiving a number of oxygen concentrators. And why this is important? Because the Ministry of Health, we spend literally millions of dollars in oxygen for our patients. And we have to buy these oxygen in cylinders and then put it at the hospital, and it costs millions and millions of dollars. What these machines would do for us is that it takes air, ordinary air, and would convert that or concentrate that into oxygen. And so what comes out of the machine is oxygen. So from ordinary air, we are able to produce oxygen for our patients. This would be extremely helpful in the interior of our country, especially places like in Region 1, Region 7, Region 8, and Region 9, where it is challenging for us to take oxygen into those communities. So by having these oxygen concentrators, it would help us greatly with our patients who would need that type of service.
India really is taking a role of a world leader in fighting COVID. Our Prime Minister Modi has been at the forefront, and we have so far helped over 100 countries in combating COVID through medical supplies, supplies of PPEs, and now India is at the forefront of working on the vaccine. Currently, there are 3 vaccines in various phases of the trials, and we believe that in early 2021, we should have a working vaccine. As you all know, this pandemic has changed the way the world has to proceed, and the Indian healthcare and pharma industry has been at the forefront of meeting this challenge.
As you know, this is a pandemic, so to have all this material, all this medical equipment, it's a really difficult process of purchase, because all the countries in the world are buying this kind of material, so it's not easy to have, and it's very important to have all the support in terms of financial, to have the possibility to access of this medical equipment. The freight of this equipment to arrive to Guyana also is very expensive. It's one of the most higher that we saw in the history, because there is a small groups that are working in this kind of transportation all around the world. So I think it's very important, and it's an important issue that Guyana has this, all this material and all this medical equipment to be better prepared to take care of all the Guyanese people that has infected or is in a bad situation in terms of the COVID-19.